We were chatting to Senior Research Associate at the University of Johannesburg, Mary Metcalfe. So Mary, the sound was really bad previously. I think you were saying, and if we can just recap, that it's a good idea, what the department is saying, that kids will go back to school every day from the end of July, if they're not going in every day at the moment, even though we're heading into the third wave. It's still a good idea, in your opinion?
It is a good idea. Children who attend school every second day or every second week are losing time for learning, and they also are not part of the daily institutional life and routines of the school. In terms of school feeding, many learners who are dependent on school feeding were not going to school to get the meals on the days that they weren't supposed to be at school. So it's been having a very negative impact on learning outcomes and on the general routines and work of schools. In terms of the third wave, I think that there is a push that's being supported by all of the teacher unions, by the Minister of Basic Education, by SABC, to say that we should prioritize the vaccination of teachers in the light of the fact that we're going into a third wave. We already are in a third wave in about 5 provinces, and learners are going back to school every day. I'm sure that all education stakeholders are aware that the risks are primarily to healthcare workers and the aged, but in the queue of people who are going to be vaccinated, teachers need to be high in the list. I think that would be a recognition of the role that they're playing as frontline workers in keeping the education system going, in keeping that contribution to the economy going, and recognizing that primary school children in particular have greater difficulty with complying with all of the COVID regulations. I think teachers should be prioritized for vaccination.
Yeah, it's hard when a little kid comes up to you and just tackles you or hugs you or something, and you're the teacher. But what is the situation right now? Because some teachers will be up in arms. We know they were concerned last time with a full schedule. But if you do have a comorbidity or something like that, you can actually stay at home, correct?
If you have a comorbidity and we're in lockdown level 1, the previous arrangement within the Education Labour Relations Council is that you could apply to not report to school, but to work from home, which is obviously difficult. There's a limited range of support functions that a teacher could do from home. That's why I would say that as we contemplate making a special dispensation in recognition of the special circumstances that teachers make to education, we should also be prioritizing teachers that have comorbidities. For teachers and for teachers with comorbidities, there's very simple mechanisms to screen. Teachers that were allowed to not report to school have already got documentation that they should be able to produce at a vaccination center. And my view is that given the complexities of the registration process, teachers should be allowed to drop in together with the pay slip demonstrating that they are employed by an education department or an education institution. And not only teachers, but also the support workers and the officers, the people who work as support staff in the school, should all be given priority status. Each individual teacher is involved in a normal school day with children that might come from 150 families. They are really in the front line.
Yeah.
We need children to go to school, and we need teachers vaccinated, at least older teachers, the 50-year age group, the 40-year age group, and teachers with comorbidities and support staff.
All right, so we'll follow those discussions between the education department and the health department. Given the infections very quickly, do you think that the department will change its mind? Because that's what happened last time. They said everybody's going to school, we're not backing down. Then they did. The department landed up looking very, very indecisive, and there was a lot of confusion created.
Last year was difficult for all of us. I was trying to reflect where my head was in June of last year. We were still trying to understand this phenomenon. So much of the science was still being established. We are going into a third wave. Most of the international evidence, and that's being reviewed by the Health MAC, is that primary school children may be that they don't manifest the visible symptoms of COVID. So they are very seldom ill or hospitalized. But that doesn't mean that they may be asymptomatic, which is why it's important to protect teachers. The Department of Basic Education has taken a decision, as I understand it, that's been based on the health science and the advice of the Health MAC. But they also are making a decision that in education terms is critically important. We need all children to go back as soon as possible, but primary school children have a statistically lower rate of becoming ill, and they need to get back to school because learning is being negatively affected. And there already has been research which shows that loss of learning is going to take years to catch up. Yeah. And we need to start it as quickly as possible.
And I mean, it could compound what we're reporting on today. 63% unemployment amongst young school leavers, basically. So a very difficult situation already. Thank you very much. That was Senior Research Associate at the University of Johannesburg, Mary Metcalfe. And time now for some sporting action with Ollie.